Hey everybody, it's Dr. Ben here. Welcome to Heart Health Month. We're in the month of February, of course, right? Valentine's Day, and we're thinking about those that we, love, and all of those wonderful things about this month and Valentine's Day. However, from a health perspective, we end up often this month talking about cardiovascular health, heart health. Matter of fact, you've seen a lot of it in the news, maybe more than ever. There's been some concerns. There's been increases in a term that a lot of people have come familiar with, myocarditis, which is inflammation of the heart and things like that. So there's people that maybe didn't think about this as much that are having to think about this a lot more. But the reality of it is that cardiovascular disease has been our number one cause of death in the United States for a long time. It used to kind of jump between cancer and heart disease, but heart disease has kind of had the run of it here for the last several years. The reason I'm talking about this, the reason that our office would even talk about this is because cardiovascular health, your heart health, your cardiovascular system is largely related, or disease in that area is largely related to our lifestyle. Now I know that we've often been told, right, it runs in the family, and there is some reality to that. There is some genetic predisposition, but I will tell you, and the science is clear on this, it's just not maybe known to the public as well, but a significant majority, matter of fact, the scientists would say 95+% of heart disease is directly related to your lifestyle. So when you start thinking about things like blood pressure, when you start thinking about things like cholesterol, when you start thinking about, blockages in the heart attacks, angina, chest pain, all of those things, what I want you to know, at least initially, is that is mostly related to your lifestyle. So what we're going to be talking about at our upcoming seminar on the 16th of February, that's a Wednesday, 6 p.m. in our office, we're going to be talking about that, right? We're going to be giving you the tools and the resources for that. But I wanted to touch base on a few of them today, just to give you a little bit of a primer. So I remember long ago when I was practicing in Sioux Falls, South Dakota, and they had a heart hospital there. And it was what was called a specialty hospital. And so primarily they only dealt with heart disease and heart attacks and heart surgeries. And there was a doctor there. She was a cardiologist, and it was a woman. And she started helping people prevent heart disease. She started helping people get off of medications, not on them. And I remember hearing about her. And I remember hearing patients that had gone and seen her. And they were so appreciative that she was, helping them get off medications, that she was working with them on their lifestyle. And then I knew some people that were part of that hospital system there. And I remember hearing that she got warned about the way she was practicing. And they said, we are not in the business of getting people off of drugs. We are in the business of getting people on drugs. We're not in the business of preventing heart procedures. We're in the business of doing heart procedures. And so they warned her that she needed to change the way that she's practicing. As the story went on, she didn't change the way she was practicing, and she was removed from that position. She was effectively fired, and she was no longer able to practice. So a lot of times I meet people, and they're looking for a holistic cardiologist. They're looking for a natural medical doctor, something like that. And so I remember as I was going through this process, I thought, well, what would that look like? What would a holistic cardiologist look like, right? And so here's a few things for you to consider, and here's what we're going to be talking about at our workshop. One of the things I'd want to know, if I wanted to know the health of my heart, is I would want to know about the nerves that control it. So you might not realize that your brain is connected, obviously, to your body. You have nerves that come out from your upper neck and your mid-back that go right to your heart. If you have pressure on those, your heart's not going to work the way that it's designed to work, right? So that would be one thing that would be really important to check. The second part would be something called heart rate variability, or stress. How is your body handling or adapting stress? You can measure that. You can measure that through something called heart rate variability, right? We do that in our office. It gives us a measurement between your automatic nerve system and how that's working, your parasympathetics and your sympathetics. Is your body in a stress response? As a matter of fact, a lot of people that you talk to, even if you talk about heart disease or you talk about even heart attacks, a lot of people will say, I'm under so much stress, right? And they, there's a lot of actually studies on this that found out extreme stress causes things like heart attacks, causes things like, high blood pressure and things like that. So we want to address that. That's another area that we can do. Then nutritionally, or the other side of nutrition, I would say, is toxicity. So there's a big part of this that's related to nutrition. What does a cardiovascular system need in order to be healthy? Why does it need that? What does that look like? A lot of the things that we call cardiovascular disease are actually, the root cause is inflammation, right? You get inflammation in your vessels. The body responds by raising cholesterol to heal that. You end up with blockages in your vessels. We call that cardiovascular disease. So we want to help you understand inflammation. We want to help you understand what does the body need nutritionally support that. And then one of the other ones that we talk about a lot is, from a fitness perspective, what do you need to do to keep that heart, which is a muscle in some regard, what do we need to do to keep that muscle healthy? I've heard recently about these stories where people have been working out. One of them was on like a Peloton riding a bike, and they're having heart attacks riding the bike. And I had to laugh about this, not laugh about the heart attack on the bike, but it's almost like they're getting a bad name and they're saying like these people are dying because they're riding a bike, like as if exercise is bad for you. That's not the case. Matter of fact, I would say the opposite, right? Lack of exercise. When you take a whole bunch of people that haven't been moving their body, then you get them to move their body, of course, there's some things that can happen. And so we want to give you, so as I was thinking about this idea of a holistic cardiologist, I'm not telling you that that's what I am, but the things that you would want. How is the nerves going to your heart? What's the nutrition look like? What's the toxicity look like? What's the fitness look like? How do we handle the stress? That's all the stuff that we're going to be covering at this event. Okay, now the good news about heart disease, cardiovascular disease, is it's a slow fade generally. Okay, now we're seeing it at younger. They're actually finding heart disease in kids as young as 9 or 10 years old. We're seeing kids have heart attacks that we've never seen before. We're concerned about that. We're concerned about the causes of that. We've never seen that in human history. We're seeing that happen in children now. You're seeing these athletes that are, tipping over in practice, and there's a lot of reasons for that and ideas for that. I don't know what those, there's a lot of discussion about what those are. We'll talk a little bit about at that seminar as well. But the earlier you get engaged, so if you're watching this, you might not have high blood pressure. You might not have elevated cholesterol. You might feel great. That's awesome. My goal for you is just to make sure that you're on the right track, that you have the things that you need. So you don't end up in a situation down the road where you're faced with, triple bypass surgery, where you're faced with, these medications. They say if you don't get on them, you're going to die, or you don't want to be on them because of the side effects or whatever. So what do you do now? And thankfully, cardiovascular health, heart health, is one of the easiest things to address, okay? One of the easiest things because it's so amenable, it's so helped by lifestyle. Now again, there's things you're going to have to do, right? But we're going to give you the best of the best, the latest and greatest. So if you or somebody you know is concerned about heart disease, struggling with heart disease, has it in their family, is on medications, and they're looking for a natural, more holistic approach to that, make sure they get registered for our workshop. It's going to be on the 16th of February. That's a Wednesday at 6 p.m. There's no charge for this, but we are limited to 60 seats. So it'll be a great seminar for you to come to. We're excited about it. We look forward to it. We will see you there.